I'm here today to talk to you about common complications that can occur after a total hip or a total knee. Typically, after a total knee replacement or a total hip replacement, there is going to be swelling that's associated with the surgery. That's very typical. And again, that's where the elevation is important to help control that. But if you see swelling that's continuing to worsen despite appropriate elevating, please call our office immediately. You can also experience calf pain or increased leg pain. This can occur on the operative leg or the non-operative leg or in both legs. If you're experiencing increasing leg pain or calf pain, please call our office immediately. There are measures that we take and encourage you to do to reduce your risk of a DVT. The first being to try and get moving after your surgery. Of course, this is no small feat as you're dealing with pain and swelling after your surgery, but we encourage you to try and get up and move as you can. Additionally, elevating appropriately is very helpful. And so if you've had a knee replacement, we ask that you either rest on a bed or a couch, flat on your back, and elevating your foot at approximately 45 degrees in the air. We ask that you not place a pillow or a cushion behind your knee so that your leg remains straight. So the next step that we can take in trying to reduce your risk of a DVT is you utilizing compression stockings or ACE wraps are referred to as well. And your surgeon will specifically give you direction on which one of those measures they will use after your surgery to reduce your risk of a clot. We oftentimes will use a medication to reduce the risk of a deep vein thrombosis. These are also known as blood thinners and commonly include medications such as Eliquis, Xarelto, Lovenox, Coumadin, and even aspirin. That'll be a choice by your surgeon as far as which medication they choose to use, and they will also tell you how long to take it for. Sometimes you can also develop what's called a pulmonary embolism or a PE. This is oftentimes the result of a deep vein thrombosis. Signs and symptoms of a pulmonary embolism include chest pain, difficulty breathing, shortness of breath, rapid breathing, sweating, or confusion. If you are experiencing any or all of the above of these symptoms, this is a true medical emergency and you should go to the nearest emergency department. Signs and symptoms of an infection can include a malodorous or foul-smelling drainage coming from the wound. Seeing the wound itself, sometimes this is a challenge because there is oftentimes a dressing over the wound. But if you find that you are seeing redness, increasing redness that is, around or under the dressing, that's a possible sign of infection. It's not uncommon to have a low-grade fever after surgery, sometimes caused from being inactive or the pain medications that you're taking. If your temperature is 100.5 or less, we encourage you to be using the inspirometer at the frequency of 10 times every 15 minutes for at least 1 hour at a time. If you find that your temperature is not responding and improving with that effort, you should contact our office. This may be the sign of infection. In summary, please pay attention to any signs or symptoms that you may be experiencing that could be indicative of either an infection, deep vein thrombosis, or pulmonary embolism. And please contact our office as instructed.